We are putting a spotlight on caring for your eyes, and Dr. Seth Krawitz is joining me here from the Virginia Eye Institute with some more details on that. How you doing, Doc?
I'm doing great.
All right, so we're talking cataracts specifically here. Someone at home isn't too familiar with cataracts. What is it exactly?
Sure. A cataract is a clouding of the lens. So the lens is part of your eye that sits behind the pigmented part. So in you and I, we have brown eyes. Yeah. The lens sits just behind that. And as we get older, the lens can get cloudy. And then when the lens gets cloudy, that's called a cataract. Yeah, we can actually, during an exam, we can actually see it. But from the patient's perspective, they have symptoms usually of blurred vision. They might have glare at nighttime driving, harder to read in dim light. So it's something that starts to basically affect their daily visual activities.
Yeah. So talk about the technology. How are you guys correcting that issue for someone?
Right, so cataracts are a surgical correction, and so you should think of it as basically lens replacement. And the exciting technology we're offering our cataract surgery patients now at Virginia Eye Institute is something called the light adjustable lens. The lens that's put in has a certain prescription to it, like your glasses or contact lenses might have. And this lens can actually be adjusted after it's been implanted. You can change the strength of it. So for example, if I do your cataract surgery and you say, you know, Dr. Krawitz, it's a little blurry here. Can you make it a little bit so my focus is a little closer? The lens can actually be adjusted after it's already been implanted in your eye. Which is pretty amazing.
I think that's blowing my mind.
Right,
like
right.
You can change. It's in your eye already, and you can adjust it.
Yeah, and so in the office, you sit in a machine, not unlike the slit lamp where you have your exam, and the lens is made of a special silicone material, which is sensitive to ultraviolet light. And so we program in what you want your vision to be, and the ultraviolet light actually alters the shape of the lens, and it changes the prescription of it. And then once it's where you want it, and your vision is where you want it, and then you have a final treatment that locks it in, and then it's set forever. It's very exciting because there is, we do preoperative measurements to try to estimate the proper strength of the lens we should put in there during cataract surgery. The best analogy I think I've heard is if you think of the lens kind of like it's like an M&M candy. It's got the candy shell. It's got the chocolate in the middle. What we do during surgery is we make a hole in the top part of the candy shell. Imagine taking that off, and you kind of take all the chocolate out. And then you take the artificial lens in, and it goes right where the chocolate part came out. That's what holds it in place. You keep the shell there. And so the lens, your lens, on average, a human lens is about 4 to 5 millimeters thick, so it sits in the shell. But the artificial lens that goes in there is only 1 millimeter thick. And so as you go through the healing process, the lens can either go a little bit forward towards the front of the shell or a little backwards towards the back of the shell. And you don't really know how that's going to go. And the effect of that, you wear glasses, so you know if you push your glasses all the way up on your nose or you put your glasses all the way down on the end of your nose, it makes things look different. So it's the same optical effect inside your eye where if the lens shifts a little bit, it'll change the focus. And so this way, if your measurements are off by a little bit or the lens shifts a little bit, you can actually adjust it after to what the patient really wants to see.